Hello everyone, this is a task regarding in-utero transfer. So let's go through the task first and then I'll explain you in what actually this in-utero transfer is. So here you are an ST5 in a district general hospital where there are only level 2 neonatal facilities. And you got this patient called Mrs. Thomas Mason. She is into her second pregnancy at 30 weeks of gestation. This is a twin pregnancy with irregular tightenings since that morning. And also, one of the twin is having a double bubble sign as per 20-week scan. Another important piece of information is she and her husband and her mother are unhappy as she has been waiting since long time and none of us has attended her. So what are the key things we have to take into consideration while looking at the task? So here you know that you don't have a tertiary facilities. She is a twin pregnancy, might be a case of preterm pain. On top of that, one of the twin is having a double bubble sign. So, what does the college expect from you in this particular station? So, what are the few important things which you should be aware in order to clear this station? So, this is not just a simple preterm task, but instead it is a in utero transfer task. So, your focus should be both in utero transfer and the preterm. So, coming to how to start the station. So how do you start? Here the patient is already upset that she has not been addressed by anyone since the admission. Hi, I'm Dr. So and so. Am I speaking to Mrs. Thomas Mason? Can I quickly confirm your age? I do apologize. I can see that you are in pain. Is there anything I can offer? And also, I'm so sorry for the delay as there were really sick patients and deliveries. I'll make sure this won't happen again in the future. Apologize for the delay and offer pain relief. This is how a good start is. Now, start by establishing aim of consultation, agenda, and start with the information gathering. I'll address all your concerns and formulate a safe and effective management plan for you, but before that, is that okay if I ask you a couple of questions? Before discussion, would you like to have your partner on your side? So always make sure for a patient in labor or the patient in pain, her partner is with her when you are discussing so that it will look empathetic and soothing. Coming to the history. So what are the key things which you need to focus on while taking history in this particular task? So you need to ask about the labor details, the pregnancy details, and also about the double bubble sign. So what are the labor details? So whenever you see a preterm in the task, whenever you suspect a preterm labor, always remember you need to ask these typical questions of a preterm case. What are they? Ask about the labor, any predisposing factors like fever or urinary tract infection, any trauma to the abdomen, which you can say as any injuries to the tummy or any fall over the tummy in the layman terms. And also, ask if there is any surgery to the neck of the womb called leads. These are the few important questions which you need to ask for a preterm patient. To summarize, fever, urinary tract infections, and any injury to the neck of the womb or any surgeries to the neck of the womb. Also try to inquire about domestic violence in a simple way. Some women find themselves in unhealthy family situations. Are you in any such kind of thing? So this is the simplest and the easiest way and the gentle way to put forward about the domestic violence. Now ask about the labor regarding the onset progression of the labor and the routine questions like is there any excess bleeding or leaking. Ask whether she is able to appreciate the baby's movements. Now coming to the pregnancy details. So what do we have to know about the pregnancy? It was mentioned it was a twin pregnancy, but we don't know what kind of twins was that. So ask the women about that. She might tell you that yes, the twins are having different placenta, different afterbirth or something like that. Whenever you see a twin pregnancy, ask whether it is a spontaneous or artificially conceived. And also inquire about any complications and her previous scans and blood reports. Now come to the double bubble sign. So what does it indicate? It can occur with many other anomalies and it can also be a part of Down syndrome. So ask whether she has been offered any invasive testing, whether she has done any invasive testing. If she says that she has declined that testing, ask why. So these are the few things apart from the routine history which you have to ask in this particular patient. So remember the labor details and the questions pertaining to the preterm pains, pregnancy details, and also about the double bubble sign. Apart from that, ask the rest of the history like medical, surgical, co-ops, her obstetric history, any allergies, BMI, blood group, and reservations. No need to ask about addictions if the patient is in severe pain, but if the patient is not in severe pain, you can ask about addictions as well after signposting. Okay, the take home message in the information gathering is whenever you see a preterm patient, ask about fever, UTI, surgeries to the neck of the womb, and in the domestic violence in the most gentle way possible. Now coming to the explanation part. So explain the patient what she is going. So how do you explain preterm labor? The simplest way is usually these kind of pains will start after that at or after 37 weeks, which we call it as labor. But for some women it can start early, which we call it as preterm pains. There could be various causes, and some causes include any urinary infections or infections elsewhere in the body, or any injuries to the tummy or any fall. Sometimes without any reason also it can happen. Are you with me so far? Now talk about Inutero transfer. So explain her what is preterm pregnancy, talk about Inutero transfer, and then talk about the medications which you are going to give to the patient. So this is simple, just in the 3 steps. Involve the MDT. So whatever care we are going to provide you will be under the team of doctors, including my consultant gynecologist, baby doctor, specialist doctor, midwife, and we will be involving your GP as well. And one important thing which you have to remember is, in this particular task, they didn't mention you about the dilatation of the cervix. So how do we find out? As she is 30 weeks, we can very well do a USG. So after explaining the patient about the preterm pains, tell her we need to do a USG to assess the cervical length and to identify the progress of labor. Now talk about in utero transfer. So what are the key things which you need to learn in utero transfer? Why you are going to do it to her, and what are you going to do when you are doing this transfer? So as your baby is having some defects in the scan which was done earlier, and also as it is too little, that is in only 30 weeks into the gestation, it is better if the delivery happens in a place where there are advanced facilities and baby can get good care. I'm really sorry to say that these facilities are not available here. But anyway, I'll check with my consultant and also the baby doctor, and I'll make necessary arrangements for your transfer. I'll also speak to the nearest facility and the consultant and the baby doctor there, and also make sure the bed availability is there in the hospital. We'll also make sure that a midwife will accompany you during the transfer. Are you with me so far? So, talk her in detail about the in utero transfer. Remember, while you are doing in utero transfer, you need to get your consultant and the neonatologist in permission. You need to inform them, arrange a midwife to accompany the patient, and also make sure that the hospital for which you are transferring the patient has the NICU bed availability. These are just the few things which you need to talk about in utero transfer. Now talk about the medications which you are going to offer her during the transfer. We are going to give you some injections called steroids which will be started. The advantages of the steroids are it helps to decrease the breathing difficulties in the child. Magnesium sulfate. Usually magnesium sulfate is given below 30 weeks. Here also you can say we might consider giving you a 24-hour long injection called magnesium sulfate after ruling out allergies. It helps to protect the baby's brain during the delivery. We'll start the injection and we'll stop it during the transfer, and it can be restarted when you reach the transferring facility. And talk a bit about the ex utero transfer also. Doctor, what happens like if I deliver on the way? Don't worry about it. In case if before transfer also we'll do a per vaginal examination to see the neck of the womb. If it seems like you are going to deliver soon, we'll deliver you here and we'll transfer the babies to the nearby facility after the delivery. So talk just one or two lines about ex utero transfer. So here you need to talk about preterm. Why is preterm pain? Don't forget to tell about USG to look for the cervical dilatation as she's 30 weeks. Now talk about in utero transfer, a note about ex utero transfer, and then regarding the medications which you are going to offer her. You can even talk about prophylactic antibiotics. You can say that we might offer you prophylactic antibiotics if you are going into labor. So these are the key things which you need to remember. In the information gathering, ask why invasive testing was not offered to her. Ask the history regarding the preterm. In the explanation, talk about preterm and its implications. USG, accompanying midwife during transfer, check the bed availability in the transferring facility, a note on ex utero transfer, and in the MDT, don't forget to involve the consultant neonatologist. That's it. Thank you.